Cervical cancer is a type of invasive cancer that starts in cells lining the cervix, more commonly referred to as the uterus's outer covering. In general, most cervical cancers can be successfully treated with surgery and/or chemotherapy, which helps remove abnormal cells from the body and prevent them from spreading throughout other parts of the body. Early detection of this cancer, however, can help alleviate some symptom risk for those who do develop cervical cancer, because it allows for more effective treatments to be used before any serious damage happens. The following are the main symptoms associated with this cancer. Unusual vaginal bleeding, either after sexual intercourse, between menstrual periods, or between pap smears. Pain during intercourse. Vaginal discharge that contains a foul odor and/or is blood-stained or watery in appearance. Abdominal pain in some cases. Stay with us to know more about cervical cancer, but before that, hit the subscribe button if you like this video to never miss our new plan to help you boost your metabolism. Each of these symptoms may seem not to be related to cervical cancer, but they can be present in various forms due to other reasons and do not always indicate a cancerous diagnosis. It is important for women to have any unusual symptom checked and have a pap smear performed as soon as possible, so they can receive a proper diagnosis and treatment before any serious damage occurs. Unwanted bleeding from the vagina after having sexual intercourse or between periods. Pain during intercourse. Discharge that is watery, bloody, or both. Pain in the lower abdomen and pelvis. Patients with any of these symptoms who are found to also have an abnormal pap smear may be further tested by a colposcopy. This is a special type of microscope which allows for visual inspection, as well as biopsy sampling of cells in the cervix. If positive, this will lead to a diagnosis of precancerous cells, which can then be treated effectively. The prognosis for women with early-stage cervical cancer is generally good, since most cases can be successfully treated. However, if the cancer has spread beyond where it started in the cervix, then there is a higher chance of spreading to other parts of the body, and some parts of the treatment may not be as effective. Some forms of this cancer, especially when found in older women, can also cause problems with fertility and pregnancy. Early detection is crucial for those who already have cervical cancer, since it allows for more effective treatments to be used, which can avoid the need for removal or surgery, and thereby reduce complications in a patient's recovery process. Surveillance of cervical cancer is an important part of a patient's follow-up treatment for this cancer. This means that each year you will have your pap smear and be examined by your doctor to make sure there are no signs of the cancer returning. In women who have had cancer in the cervix before, it can also be necessary to have regular pelvic exams with a transvaginal ultrasound to keep track of any changes or abnormalities in the cervical lining, uterus, and ovaries. Cervical cancers are highly treatable when they are caught early, but they can still spread throughout the body. There are tests which can aid in the detection of cervical cancer and may prevent its spread, but it is important for women to be aware that the tests are not 100% certain, and further testing is always necessary whenever a pap smear reveals any abnormal findings. Another precautionary measure to avoid the spread of cervical cancer is regular use of condoms during sexual intercourse. If you have abnormal cells in a pap smear, you may need to have surgery or biopsies taken from different parts of your body. It is also important for you to attend all scheduled follow-up appointments, because if your cancer is caught early enough, it can be cured with treatments like radiation or chemotherapy. If you have any questions, it is always a good idea to speak with your medical practitioner. If you suspect that you have cervical cancer, then talk to your doctor as soon as possible and consider having a pap smear performed immediately. Women under age 30 who had sexual intercourse within the past year should especially be aware of this warning and get themselves checked out right away. Although there are a few different types of cervical cancers, the cancer in this part of the vagina is almost always caused by human papillomavirus, HPV. HPV is a common virus transmitted through sexual intercourse and can be caught from having unprotected sex with an infected partner. There are approximately 30 different types of HPV which can cause cervical cancer, but only about 10 of these types affect women. In order to treat this type of cancer, doctors will take biopsies from cells present in the cervix and examine them under a microscope to see how far the abnormal cells have spread in the body. However, if this cancer has already spread to other areas of the body, then it is possible that certain treatments may not be successful or may actually make the cancer worse. This is why it is important for women with any abnormal symptoms to be examined by a doctor immediately. If found early enough, this type of cancer can often be cured with surgery and/or radiation therapy. There are a few different types of cervical cancers which are caused by HPV. The first type of cervical cancer that doctors will look at when they suspect it is due to HPV is called cervical intraepithelial neoplasia, CIN. CIN is a condition in which abnormal cells form within the walls of the cervix, but are not yet cancerous. If left untreated, this type of cervical cancer can spread throughout the body and cause problems with fertility in pregnancy. However, because it is a precancerous condition, it can be effectively treated by removing the abnormal cells and using alternative methods to prevent their return, such as using intracision devices or wearing condoms. The second type of cervical cancer that doctors will look at is cervical dysplasia. Cervical dysplasia is also caused by HPV, but unlike CIN, it has not yet formed into cancerous cells or spread throughout other parts of the body. Cervical dysplasia can be effectively treated with a hysterectomy, which removes the abnormal tissue in the uterus in order to prevent any further spread of cancer. If left untreated, cervical dysplasia can sometimes cause problems with fertility, resulting in unexplained infertility, but this is uncommon. We hope you enjoyed this video and learned new things about cervical cancer cells. If you have any questions, feel free to leave a comment below. Also, don't forget to let us know if this worked for you and how it affected your body. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.